Hi, I'm Jacqueline Catalini. I'm a speech therapist from Salus University. Today we're going to talk about oral motor skills.
Hi, my name is Erin Priswalinski, and I'm a first year graduate student at Salus University in the Speech-Language Pathology program.
Hi, I'm Ashley. I'm also a first year student in the Speech Language Pathology program at Salus University.
And hi, I'm Shelly Davidson. I'm also a first year grad student at Salus University for the Speech Language Pathology program.
Thanks for joining us today. This is a class that we regularly hold at the Breastfeeding Resource Center. We have different topics every week, and this week we're going to tell you about oral motor skills, what they are, why they're important, and then talk about some of the hot topics you may have heard of as a new parent, which include pacifier usage, using a bottle, when to wean from a bottle, and sippy cups. So I'm going to hand it over to my grad students to get started.
Hi, so I'm going to start by just defining what oral motor development is. So, oral motor development refers to the use and the function of the lips, the tongue, the jaw, the teeth when they eventually come in, and the hard and soft palates. And the movement and coordination of all of these structures is very important in things like speech production, safe swallowing, and consuming different foods, especially foods that have various textures. Um, Normal oral motor development begins prior to birth when the baby is still developing, and then it continues even beyond age 3. So it is something that is very important considering it is used for speech production, safe swallowing, and consuming lots of different foods. So to start, the baby from when they are first born obviously gets most of their food intakes from formula or breast milk. So they are just either breastfeeding or feeding out of a bottle, which is great. And then from around 2 to 6 months, the baby will start recognizing that their bottle, or if they're being breastfed, goes to their mouth and how to suck that in order to swallow it, and and can be safely swallowing the formula or breast milk. Maybe in the older months, like 5 or 6 months, you're introducing some soft foods like rice cereal or pureed fruit. Here, they might not be swallowing it fully. They might be making a mess or swallowing with their mouth open, and that's okay because they are still learning, and that's a great way to introduce these soft foods as well. When they're a little older, around 7 to 9 months, they may you may start to see in your child a full lip closure, which that is great, and that is right on track with where they're supposed to be. Maybe they start to hold their bottle independently and know that they have to bring it to their mouth because that's what they associate with feeding. And then again, they're still maybe eating pureed foods and starting to swallow it more safely and eating more of it as well as they develop and get older. Around 10 to 12 months, this is when they start more chewing the food and feeling the different textures that are in their mouth instead of just swallowing it right away. A lot of the times around this age, they may demonstrate lip closure while swallowing liquids and soft foods, so it's not as messy as when they were younger, around 6 months when you were just starting to introduce it. They may begin to self feed themselves using their fingers and bringing it to their mouths, and they know how to safely do that, of course, with a parent or a caregiver monitoring them. They may begin to experiment drinking liquids from a sippy cup at this age. So, this is, like I said, around 10 to 12 months. And then Shelly's gonna get into more about sippy cups later on. Um, they may begin to consume mashed table foods as well, and this is a very exciting time for them because they are experiencing a lot of different textures of food. So it can be confusing for them at first, but once they get used to it and know how to safely chew it and swallow it, it is great for their development. They also learn to move the food in their mouth side to side and how to chew it more. And then around 18 to 24 months, they are able to use a spoon themselves. Of course, it's not going to be perfectly, but they may be able to know how to clean off the spoon with their tongue or their lips or their mouth and put it into their mouth. Or they even associate it with their parent or caregiver feeding it to them, and they know how to wipe the spoon clean into their mouth in order to consume the food that's on it. Around 24 to 36 months, this is when the jaw movements and they eat with more efficiency. So they are definitely chewing more food because they are eating more food that's not pureed and easier to swallow. So they can crunch through a little more tough food like goldfish or crackers, and they're properly breaking that down and they're able to properly swallow that and safely swallow that.
I'm just going to add in here that so your baby is first, has a reflex for nursing or sucking from the bottle. Then they kind of learn how to actually do this on command. They see the breast or they see the bottle and they know it means it's time to eat, and they know how to strip the bottle or how to nurse off of the nipple. Then they start eating and their mouth is just kind of mashing that food and moving it around, maybe even suckling it back. And then, like you were saying, around that 10 to 12-month mark, you really see more of like an up and down mash, chew, swallowing it back. And then later in toddlerhood, you're going to see more of that mature chew where they look like an adult and they can handle a wider variety of foods.
Yeah, thanks for adding that in. Um, and then after 36 months, so anywhere from 36 months and older, normally they say around till 5 years old, the child may progress towards chewing and swallowing advanced textured foods. These can be things like meat, fried foods, or whole fruits because they have a stronger jaw and teeth that will be able to break it down more easily. And then it is very important, obviously, to have a caregiver there to supervise to make sure they're being safe. Also, the child may begin moving from the sippy cup to drink from an open cup and know how to gulp that water or juice, whatever's in the cup, and safely swallow it. Speaking of cups, now Shelly is going to take over and introduce sippy cups and their importance and when to introduce them.
Okay, hi. So I'm gonna kind of go through a progression. So I want to start by first talking about sippy cups. Then we're gonna move quickly to straw cups and why we're again moving from a bottle to sippy cups. And then I'm gonna talk about the benefits of an open cup at the end. So sippy cups can be used as a transition between bottles and open cups because they can minimize spills. And when you start using a sippy cup, you want to use it for all liquids. You want to use it for milk right away and then switch it to an open cup as soon as your child can manage it, which is usually before the age of 2. Keep in mind that your toddler only really needs to drink when she's thirsty or with meals. If you want to let her hold the cup most of the day, like a security blanket, she might end up over drinking and she's going to need more frequent diaper change. Frequently drinking milk, juice, or sodas can also lead to tooth decay because teeth are continually being bathed in those sugary liquids, which is why you want to keep it to more like thirsty situations or eating during meals. You don't want to let your kid go to bed with a sippy cup or a bottle because if your baby falls asleep while drinking from that sippy cup, they might end up with milk or those juices in their mouth, which again is going to decay their teeth. So you want to make sure to separate your baby from her drinking, whether it's from a bottle or a cup before bed. One example of a sippy cup,
Can
which
I
I
ask a
bet some of you.
question? When is
Yep.
a good time to start with a sippy cup?
So usually it's around 8 months to 12 months is a good time to start with a sippy cup. You kind of want to keep going with the bottle and the sippy cup at the same time to kind of get them to transition to the sippy cup. But hopefully, your child should be able to start drinking or at least being introduced to that open cup around 6 to 8 months. It could be with you. So if they see you drinking from that open cup, you can kind of pass it to them and see if they can kind of play with it a little bit.
Or you
We
can
do.
hold it yourself and give them a little sip. A good time, just like you're saying, 8 to 10 months for a sippy cup, or even
Mhm.
younger with an open or sippy cup. About when they're sitting down to start solid foods is usually a good time to start playing in the cups, somewhere between 6 and 8 months.
Yeah. Again, and it is obviously going to get messy because that open cup doesn't really have that safe protection that sometimes sippy cups do have. So they sometimes recommend maybe removing the carpets around those play areas or your living room. That might protect those carpets from the juices. We don't really recommend sippy spout cups, so the ones that kind of have like that nipple looking quality. They don't really promote that mature swallow. So if you're going to use a sippy cup, there's sippy cups called Munchkin Miracle 360 Trainer Cups. They kind of have those handles on the side, and the top looks more like an open cup. So your baby has to learn how to tilt the sippy cup, and kind of teaches them how to do that mature swallow. Really quickly, to define the mature swallow and immature swallow. So before your baby is 12 months, they kind of have the immature swallow pattern. So it's known as tongue thrust swallow. That's how they receive their nourishment, by sucking either a breast or a bottle. But as they approach 12 months, the immature swallow becomes ready to mature. So this is why parents are encouraged to transition their baby from a bottle to a cup around 12 months of age. Um, a mature swallow involves lifting the tongue tip to the alveolar ridge, which is right behind the teeth. So using open cups and sippy cups kind of starts promoting that tongue elevation, where bottles don't really promote that, and don't really help them mature. Again, with an open cup, they want to make sure you're introducing it carefully, and you want to do it again at 6 months to 8 months to kind of start getting them introduced to it. If you wait a little bit, or if your child's a little older, that's okay too. Just introduce it as soon as you can. And I
I just want
believe,
to add on to that, that there's a variety of cups out there for transitioning from a bottle to an open cup. And really,
Mhm.
the biggest thing is just making sure that you have different kinds of cups for your baby and toddler to drink out of. Because again, if you're using maybe a more old school hardtop sippy cup, it promotes that immature sucking and swallowing pattern. But
Mhm.
say you were gifted a bunch of them, don't throw them out. You could use them on the go, but just being mindful of the fact that you're switching it up. You're not using that type of sippy cup every day, all day, that you're practicing with the open cup, that you're trying a straw cup, that you're maybe trying more of the assisted Miracle 360 type of cup that helps promote that more natural kind of drinking and swallowing. So just keep that in mind.
Yep. A combination of all of them is good too, as your baby's getting used to it. You don't want to just throw away their bottle or tell them they're not allowed to have a bottle anymore. It's kind of good as combining it and continuing to reinforce that open cup. And then I'll hand it over to Ashley. She could talk some more about pacifiers.
So I'm going to be talking about pacifier use in babies and toddlers. It's recommended that you are working towards weaning off of a pacifier and limiting it around 1 to 2 years old. And you want to try to completely eliminate it by 3 and 4 at the latest. So when is the best time to wean from the pacifier? So as I said, you want to start around 1 to 2 and latest 4. And the American Academy of Pediatric Dentistry agrees that this non-nutritional sucking is normal for babies and young children. And that's why we recommend weaning it around 3, because it's still a way of soothing and self-soothing for the baby. So you can assist in this as a parent or caregiver, or you can allow your child to begin self-weaning on their own. And this is very dependent on your child and how they seem to be using the pacifier or not using the pacifier. So there's some techniques and strategies on how to wean your baby off of the pacifier. And some of these techniques are limiting it at times that your child may not really need to be sucking on the pacifier. So you may want to offer some alternatives, such as a rattle or a toy or a blanket that may help them in the situations where they're typically using a pacifier, and limiting it to times in the day where they can use it before bed and then take it away so that they can sleep through the night. That's another example of limiting those pacifier use for your infant. You want to also wean your baby gently and slowly, and maybe some good ideas would be when your baby is distracted by other things. So you could try to take it away when they have a strong need to suck, and maybe give them something else that will help keep them soothed in this period of time. It's also worth noting that if you take the pacifier away at an age when their sucking urge is very strong, you may want to give them something else, because you don't want your baby to end up sucking on something else, such as their thumb. You want to try to eliminate that sucking behavior completely from their child.
So maybe like some safe chew types of toys that you kind of see. They look sometimes like a strawberry or a little nubby kind of thing. Sometimes they're even softer toys, just something to give them that safe oral stimulation that they're craving.
Yes, absolutely. And that goes along with giving them choices. So, one of the best ways to work with your toddler is to give them those acceptable choices that will help them in times where they feel distressed, and you still want to provide them with something that will help reduce any stress for the baby. Another good thing to know is when you're working on weaning your child off of a pacifier, you could reward your child with a toy, or you want to make sure they stay in that comfort zone. You don't want them to become overwhelmed without it. So, kind of rewarding them for that stretching time away from the pacifier is also a good technique to include. I wanted to also talk about some pros and cons of the pacifier. And some of the main pros, as you may notice with your toddler or infant, is that it helps them self-soothe and it reduces those crying behaviors. Another pro of a pacifier is that it's something to have in their mouth when they're self-craving. So they may not be hungry, but they may still crave that sucking technique. So that's another reason why pacifiers are a pro for the baby. It's also going to help them be distracted from any stressful stimuli. And that's really important for babies when you're trying to minimize infant crying. Some cons of the pacifier is that if used for too long, which is why we say we want to get the child off of it by 4 years at the latest, it could cause some dental malocclusions in the shape of the teeth and the mouth, especially if they continue to use it into those later toddler years, as Erin talked about all of the stages of development. Another thing to note is that it may end up causing too much dependence for the child. So your toddler may become reliant on the pacifier, and you want to encourage dependence without it. So as I said, using other toys, chewing objects to distract them and continue with those soothing techniques. And one other thing to note is that the only way a pacifier could impact the speech and language development of your child is if they're using it all day, which is why we highly recommend to give them specific times throughout the day to use it and not allow your child to suck on the pacifier throughout all times of the day. It will limit their vocal play and their speech opportunities, babbling opportunities, and also talking around with a pacifier still in their mouth. So this is just something to take note of and make sure you're aware of when your child is using a pacifier.
Great. Thanks, guys. I hope you got some helpful tips and now understand what oral motor skills are. So some key takeaways are you're trying to wean from a bottle around 12 to 18 months, and you can mix that up by moving to an open cup or a sippy cup. To keep in mind that you want to vary the sippy cups that you're using, straws, a more natural type of open type of cup, and if you're having trouble with straws, you can always use a honey bear cup. That's an option. And then with pacifiers, just keeping in mind that you're trying to shoot for weaning them by 3 years of age. And a lot of babies find comfort from it, and it's helpful for parents, and that's okay. All right. Well, I hope that was helpful, and I look forward to seeing you at future classes. We're every Monday at 11 a.m.